Hello, and welcome to our YouTube channel, Equation by Pharmacist Moms. Today, we're diving into the crucial topic of drug interactions. Drugs help patients feel better and stay healthy. But sometimes drug interactions can affect how a drug works or cause unwanted side effects. Understanding how different medications can interact is vital for everyone's health. To avoid such interactions, it's essential for a patient to communicate with the pharmacist or healthcare provider about all the medications he or she is taking. This includes prescriptions, over-the-counter drugs, supplements, and even herbal remedies. First off, what is drug interaction? A drug interaction is a reaction between two or more drugs, or between a drug and a food, beverage, or supplement. How many types of drug interactions are there? The effect a drug has on a person may be different than expected, because that drug interacts with another drug the person is taking, that is, drug-drug interaction. Food, beverages, or supplements the person is consuming, that is, drug-nutrient interaction. Another disease the person has, that is, drug-disease interaction. The effects of drug interactions are usually undesirable and sometimes harmful, as interactions may increase the actions of one or more drugs, resulting in side effects or toxicity. Decrease the actions of one or more drugs, resulting in failed treatment. Let's break down each of them with examples. Drug-drug interactions occur when one medication affects the way another medication works in the body. There are several types of drug-drug interactions, including additive interaction. When two drugs with similar effects are taken together, the combined effect can be stronger than when each drug is taken alone. For instance, taking two pain relievers, both containing acetaminophen, can lead to an overdose and potential liver damage. Likewise, a patient can take two drugs, being unaware that they have same active ingredient, often at least one of them is an over-the-counter drug. For example, people may take a cold remedy and a sleep aid, both of which contain diphenhydramine, or a cold remedy and a pain reliever, both of which contain acetaminophen. This kind of duplication is likely with the use of drugs that contain multiple ingredients, or that are sold under brand names, consequently appearing to be different, but actually containing the same ingredients. This can also occur when people visit more than one physician, obtain prescriptions at more than one pharmacy, or both. Physicians who are not aware of what others have prescribed may inadvertently prescribe similar drugs. For instance, excessive sedation and dizziness can occur when one physician prescribes a sleep aid and the other prescribes another drug. For example, an anti-anxiety drug that has similar sedative effects. Synergistic interaction occurs when two medications taken together produce a more potent effect than expected. An example is the combination of alcohol and certain antihistamines, which can significantly increase drowsiness and impairment. Antagonistic interaction occurs when one drug diminishes the effect of another. For example, taking an antacid with an antibiotic, like doxycycline, can reduce the absorption of the antibiotic, making it less effective. Some drugs affect the way the body metabolizes or eliminates other drugs. For example, St. John's wort, a herbal supplement, can increase the breakdown of certain medications, like birth control pills or antidepressants, reducing their effectiveness. Chemicals in cigarette smoke can increase the activity of some liver enzymes. As a result, smoking decreases the effectiveness of some drugs, including theophylline, which is a bronchodilator. Some drugs affect the rate at which the kidneys excrete another drug. For example, large doses of vitamin C increase the urine's acidity and thus may change the rate of excretion and activity of certain drugs. For example, the rate of excretion may be decreased for acidic drugs, such as aspirin, but may be increased for basic drugs, such as pseudoephedrine. Here are a few more examples of drug-drug interactions. The first drug-drug interaction that we are going to discuss is between warfarin and antibiotics. Warfarin, a blood thinner, having brand names Coumadin, when taken with certain antibiotics, like erythromycin, can increase the blood-thinning effect of warfarin by decreasing the activity of the enzyme system, potentially leading to excessive bleeding. The upcoming interaction that we are going to learn is between warfarin and barbiturates. By increasing the activity of liver enzymes, barbiturates such as phenobarbital cause the anticoagulant warfarin to be inactivated more quickly and thus to be less effective when taken during the same time period. When drugs that affect liver enzymes are used in patients taking warfarin, physicians monitor these patients more closely and adjust the dose of warfarin to compensate for this effect. The warfarin dose is adjusted again when other drugs are stopped. The following interaction that we are going to talk over is between warfarin and aspirin. Warfarin and aspirin are both blood thinners. Taking them together increases the risk of bleeding because they have additive effects on blood clotting. Succeeding interaction that we are going to converse about is between metformin and iodinated contrast dye. Metformin and iodinated contrast dye, when used together, can increase the risk of kidney problems because the dye can interfere with metformin clearance from the body. To come is the interaction between SSRIs and triptans. Combining certain selective serotonin reuptake inhibitors, often used for depression, with triptans used for migraines, can increase the risk of a rare but serious condition called serotonin syndrome due to an excess of serotonin. Next interaction is between birth control pills and antibiotics. Some antibiotics can interfere with the effectiveness of birth control pills, reducing their contraceptive effect. Adjacent is the interaction between lithium and diuretics that are water pills. Diuretics can reduce the body's ability to eliminate lithium, leading to increased levels of lithium in the blood, potentially causing toxicity. Forthcoming is the interaction between nonsteroidal anti-inflammatory drugs that are NSAIDs and diuretics that are water pills. Nonsteroidal anti-inflammatory drugs, such as ibuprofen, which are taken to relieve pain, may cause the body to retain salt and fluid. Diuretics, such as hydrochlorothiazide and furosemide, help rid the body of excess salt and fluid. If a person takes both types of drugs, the NSAID may reduce the diuretic's effectiveness. Oncoming interaction that we are going to debate is simvastatin and amiodarone. Simvastatin is a statin, and amiodarone is an antiarrhythmic drug. The combination can increase the risk of muscle problems because amiodarone affects the metabolism of simvastatin, leading to higher levels in the body. Following is the interaction between fluconazole and simvastatin. Fluconazole, having brand name diflucan, stops certain CYP450 enzymes from working properly, which means fluconazole interactions are common. For example, fluconazole causes blood levels of cholesterol medication simvastatin, having brand name Zocor, to go up. This can make simvastatin side effects more likely. Subsequent is the interaction between digoxin and amiodarone. Digoxin, having brand name Lanoxin, is a heart medication. It has narrow therapeutic index. This means that a slight change in its dose could cause serious problems. Because of this, digoxin can be vulnerable to drug interactions. Amiodarone, having brand name Pacer-1, another heart medication, can interfere with how much digoxin reaches the bloodstream. This can lead to higher amounts of digoxin than usual, and therefore more side effects. Alongside is the interaction between beta blockers and beta-adrenergic stimulants. Certain beta blockers, such as propranolol, taken to control high blood pressure and heart disease, counteract beta-adrenergic stimulants, such as albuterol, taken to manage asthma. Both types of drugs target the same cell receptors that are beta-2 receptors, but one type blocks them and the other stimulates them. Adjoining is the interaction between acid-blocking drugs and antifungal drugs. Acid-blocking drugs, such as histamine 2 blockers and proton pump inhibitors, raise the pH of the stomach and decrease absorption of some drugs, such as ketoconazole, a drug for fungal infections. Successive is the interaction between ondansetron and dofetilide. Ondansetron, having brand name Zofran, is a medication used to prevent nausea and vomiting. But it has a number of potential interactions. One example is with the heart rhythm medication dofetilide, having brand name Ticacin. Both medications can lengthen the amount of time between heartbeats. When used together, this time can get too long. This can result in dizziness, fainting, and even death in severe cases. This interaction tends to be more severe when ondansetron is injected into a vein. The last interaction that we are going to confer about is between levothyroxine and omeprazole. The thyroid medication, levothyroxine, having brand name Synthroid, is another example of a narrow therapeutic index, or NTI medication. Omeprazole, having brand name Prilosec, lowers acid production in stomach to treat heartburn. But omeprazole can lower the absorption of levothyroxine, making it less effective. So, we need to watch out for medications that could affect the working of narrow therapeutic index drugs. How can the risk of drug-drug interaction be reduced? The risk of drug-drug interaction can be reduced by keeping each doctor informed about all drugs being taken if a patient is visiting more than one physician, and by using one pharmacy to obtain all prescriptions. It is helpful to keep an up-to-date written list of all drugs being taken and to bring the list along on each physician visit. In addition, patients should not take previously prescribed drugs, such as a sleeping pill or painkillers, without consulting with the doctor or pharmacist, because that drug may duplicate or otherwise interact with one of their current drugs. What are drug-nutrient interactions? Let's discuss. Nutrients include food, beverages, including alcohol, and dietary supplements. Consumption of these substances may alter the effects of drugs the person takes. Let's learn them in detail. Like food, drugs taken by mouth must be absorbed through the lining of the stomach or the small intestine. In consequence, the presence of food in the digestive tract may reduce absorption of a drug. Often, such interactions can be avoided by taking the drug 1 hour before or 2 hours after eating. Even though numerous people do not consider alcohol a nutrient, it affects body processes and interacts with many drugs. For example, taking alcohol with the antibiotic metronidazole can cause flushing, headache, palpitations, nausea, and vomiting. Doctors or pharmacists can answer questions about possible alcohol and drug interactions. Dietary supplements, counting medicinal herbs, are products that contain, for example, a vitamin, mineral, herb, or amino acid and that are considered as a supplement to the normal diet. Supplements are regulated as foods, not as drugs, so they are not tested as comprehensively. But they may interact with prescription or over-the-counter drugs. People who take dietary supplements should tell their doctors and pharmacists so that interactions can be avoided. Drug-nutrient interaction can occur when drugs affect the absorption, utilization, or excretion of nutrients in the body, or when nutrients impact the effectiveness or metabolism of drugs. Some medications can interfere with the absorption of nutrients. For instance, proton pump inhibitors, or PPIs, used for heartburn and acid reflux, can reduce the absorption of calcium, magnesium, and vitamin B12. Certain nutrients can affect how medications are absorbed. An example is taking iron supplements with vitamin C, which enhances the absorption of iron in the body. Nutrients can impact the way the body metabolizes medications. As we have already discussed in this video, St. John's wort, a herbal supplement, can speed up the breakdown of certain medications, reducing their effectiveness. Let's discuss a few examples of drug-nutrient interactions. The first drug-nutrient interaction that we are going to learn is between calcium and antibiotics. Calcium-containing foods or supplements can bind to tetracycline antibiotics in the stomach, reducing the absorption and effectiveness of the antibiotic. To come is the interaction between vitamin K and blood thinners. Vitamin K plays a role in blood clotting. Warfarin, a blood thinner, works by interfering with vitamin K's role. Therefore, maintaining consistent levels of vitamin K intake is important to ensure the proper functioning of the medication. Therefore, sudden changes in vitamin K-rich foods, like leafy greens, can impact the medication's effectiveness. The upcoming interaction that we are going to discuss is between grapefruit juice and statins. Grapefruit juice can interfere with the metabolism of statins, which are cholesterol-lowering drugs, and increase the levels of the medication in the blood. This raises the risk of side effects, like muscle pain or liver damage. Succeeding interaction that we are going to talk over is between dairy products and antibiotics. Dairy products can reduce the absorption of certain antibiotics, like tetracycline, affecting their effectiveness. Subsequent is the interaction between tyramine and monoamine oxidase inhibitors, that are MAOIs. Monoamine oxidase inhibitors, used for depression, interact with foods high in tyramine like aged cheeses, cured meats, and certain wines. Consuming these foods can lead to a hypertensive crisis due to an interaction with MAOIs. Alongside is the interaction between monoamine oxidase inhibitors, that are MAOIs, and aged meats. Taking a monoamine oxidase inhibitor, such as selegiline having brand name Emsym, or phenelzyne having brand name Nardil, stops the body from breaking down a protein, called tyramine. Aged meats, such as sausage and salami, have high amounts of tyramine. Too much tyramine in the body can lead to a sudden rise in blood pressure, which can become dangerous. To avoid this, one should follow a diet that's low in tyramine if he or she is taking an MAOI. Adjoining is the interaction between alcohol and medications. Alcohol can interact with a wide range of medications. It can increase the sedative effect of certain drugs, like benzodiazepines or opioids, leading to excessive drowsiness or even respiratory depression. It can also exacerbate the side effects of medications, such as causing stomach irritation, with nonsteroidal anti-inflammatory drugs, like ibuprofen. Diabetes medication metformin and alcohol both can raise the amount of lactic acid in the bloodstream. This can lead to a rare but life-threatening complication, called lactic acidosis. So, it's best to avoid drinking alcohol with metformin when possible. To come is the interaction between high-fat meals and certain medications. Some medications, especially those with low solubility in water, are better absorbed with food. However, high-fat meals can significantly delay the absorption of certain drugs, like antibiotics or some cardiovascular medications. Successive is the interaction between dietary fibers and medications. Fiber can interfere with the absorption of some medications. For example, taking certain medications with a high-fiber meal can decrease their absorption and effectiveness. Why is it important to understand drug-nutrient interactions? It is crucial to understand the drug-nutrient interactions to ensure that drugs work effectively and to prevent potential nutritional deficiencies or adverse effects. Healthcare professionals can provide guidance on managing these interactions, encompassing adjusting medication timings or diet recommendations to minimize their impact. What are drug-disease interactions? Let's find out. Drug-disease interactions occur when a medication prescribed for one condition negatively affects another existing health issue. This can result in complications, exacerbation of symptoms, or interference with the treatment of the pre-existing conditions. Drug-disease interactions can occur in any age group but are common among older people who tend to have more diseases. Here are a few examples. The first drug-disease interaction that we are going to discuss is between nonsteroidal anti-inflammatory drugs and peptic ulcers. Nonsteroidal anti-inflammatory drugs can aggravate or cause peptic ulcers. They inhibit the production of protective stomach mucus, making the stomach lining more vulnerable to damage by stomach acid. This can exacerbate the symptoms of existing ulcers or cause new ulcers. The upcoming interaction that we are going to learn is between beta blockers and asthma. Beta blockers, used for heart conditions, can sometimes trigger bronchospasms in people with asthma by blocking the effects of adrenaline. This can worsen breathing difficulties for those with respiratory conditions. The following interaction that we are going to talk over is between antihistamines and glaucoma. Antihistamines such as diphenhydramine, having brand name Benadryl, can increase eye pressure, which is problematic for individuals with glaucoma. Elevated eye pressure can worsen their condition and potentially lead to vision complications. Succeeding interaction that we are going to converse about is between diuretics and gout. Diuretics, used to manage conditions like high blood pressure and heart failure, can increase the level of uric acid in the blood. This elevation can trigger or worsen gout, a condition caused by the accumulation of uric acid in the joints. To come is the interaction between furosemide and severe kidney disease. Furosemide, having brand name Lasix, is a diuretic or water pill. It helps the kidneys remove extra fluid from the body. But for people with severe chronic kidney disease, furosemide may not work as well as it should. In this case, a higher dose of furosemide is needed to effectively remove extra fluid from the body. The upcoming interaction that we are going to discuss is between certain antibiotics and myasthenia gravis. Certain antibiotics, like fluoroquinolones, can worsen symptoms of myasthenia gravis, a neuromuscular disorder. These antibiotics can interfere with the neuromuscular transmission, leading to increased muscle weakness in affected individuals. The following interaction that we are going to talk over is between corticosteroids and diabetes. Corticosteroids used for various conditions can elevate blood sugar levels, which can be problematic for individuals with diabetes. They can interfere with insulin sensitivity and glucose regulation, making it challenging to manage blood sugar levels. Succeeding interaction that we are going to converse about is between aspirin and bleeding disorders. Aspirin, commonly used as a blood thinner, can exacerbate bleeding disorders. While it's beneficial for some heart conditions, it can pose a risk for individuals with bleeding disorders like hemophilia. To come is the interaction between acetaminophen and liver disease. Acetaminophen, having brand name Tylenol, is safe for most people to use, but it could be harmful if an individual has liver problems, as acetaminophen is broken down by the liver. If the liver isn't working properly, acetaminophen can build up to toxic levels and cause liver damage. If an individual has liver disease, he or she may need to use a lower dose of acetaminophen, or avoid it altogether. Next interaction is between antidepressants and bipolar disorder. Some antidepressants can potentially induce manic episodes in individuals with bipolar disorder. The use of certain antidepressants, without mood stabilizers, can trigger manic or hypomanic episodes in these patients. Adjacent is the interaction between stimulants and anxiety disorders. Stimulant medications, used for attention deficit hyperactivity disorder, that is, ADHD, can worsen symptoms in individuals with anxiety disorders. Stimulants can increase feelings of nervousness or exacerbate anxiety symptoms. Forthcoming is the interaction between calcium channel blockers and heart failure. Calcium channel blockers, used to manage high blood pressure, can exacerbate heart failure symptoms in some individuals. They can decrease the heart's pumping ability, which is problematic for those with heart failure. Following is the interaction between pseudoephedrine and high blood pressure. Pseudoephedrine, having brand name Sudafed, a nasal decongestant, works by tightening blood vessels in nose and sinuses. But it also affects blood vessels throughout the body. This can cause the blood pressure to go up. Generally, it's recommended to use allergy medications that don't contain a decongestant if an individual has high blood pressure. Why it is important to understand drug-disease interactions. It is critical for a healthcare professional to understand drug-disease interactions to make informed decisions about medication management, especially for individuals with multiple health conditions. It is essential for a patient to communicate all his or her medical history and conditions to healthcare provider to avoid potential complications from drug-disease interactions. Why is it critical to understand drug interactions? Understanding drug interactions and their potential impacts on medication effectiveness and side effects is essential. It can help healthcare providers to tailor treatment plans and minimize potential complications for individuals with specific health conditions. They can also provide guidance on managing these interactions, including dietary adjustments or timing recommendations to optimize the medication's efficacy. Because there are so many drug interactions, many doctors and pharmacists reduce the risk of problems by checking reference books and computer software programs when prescribing or dispensing prescriptions for additional drugs. In most pharmacies, drug orders and prescriptions are reviewed using a computer system that automatically checks for drug interactions. Have an open communication with your healthcare providers regarding drug interactions, as they are trained to understand the complexities of medications and how they interact within the body. Discussing your medications with them is a cornerstone of safe and effective treatment.